Hi, this presentation on angels. Angels is active network group of emergency lifesavers. Before starting the details of angels, I would like to mention few facts and ground realities existing in Calicut, in Kerala, and in India. As far as emergency medical care is concerned, in India, it is poorly developed, it is poorly understood. All the more, it is not yet identified as a national priority, and very often the government, the people, all are it is taken for granted. Emergency care, we have three components, that is care at the scene, then care during transport, and thirdly the destination care. For a best outcome, all these three care should be optimized. The ground reality existing in Calicut district in Malabar Institute of Medical Sciences, we are receiving at least 68 to 100 broad death cases per year. MEMS is a corporate hospital. The bigger center like medical college and other centers also available in Calicut. If the MEMS has this much number, you can assume what will be the number in the Calicut Medical College and other medical colleges. According to NATPAC, this is a government agency. There is a government traffic and transportation research agency. According to their results, there are more than 4,500 deaths on the road in Kerala in 2011, and more than 25,000 people were injured in road traffic accidents in Kerala. On average, at least one spine injury per month are getting following trauma in MEMS. One fact we should understand how the dangerously ill patient reach in hospital. Honestly, 90% of the sick patients and almost all trauma victims and almost all cardiac arrest cases are reaching hospital using the vehicles like auto rickshaw, car or jeep. So how can we change or how can we bring down the deaths and the mortality and the morbidity? Definitely one thing like we should increase the basic level awareness and education, especially in basic life support and basic trauma care for the public and policemen, etc., etc. Definitely, we should redefine our road conditions. MEMS, Angels, and other agencies in association with Indian Medical Association started first response provider course recently for policemen. We trained more than 75,000 people in basic life support across Kerala. We also created a huge awareness on BLS and the concept of emergency medicine recently. But we also think about some few parallel concerns, like how to improve the transport conditions of a sick patients. How can it implement in a country like in India with one, one, 121 crores of people? What are the government initiatives already? A country with a huge population with no definite concept about the pre-hospital care system is a real problem when we are thinking about an economical model. At the same time, in corporate hospitals and other areas, there are there are vehicles that is otherwise called mobile ICU or the ICUs on the wheels. They are usually used to transport sick patients from one center to another center. Practically, this system is not involving in the real pre-hospital care like to transport a patient from the road or from the home to the hospital. And the second aspect, this ICU on wheel concept or the mobile ICU concept, all the more little bit more costly as well. So in reality, the pre-hospital care scenario remain unchanged even in metro cities. So where this is a point where we thought about the concept, a human innovation concept, otherwise called the active network group of emergency lifesavers, that is angels. So the angels aim to enhance and enforce the pre-hospital care to reduce the mortality and morbidity of victims of trauma and emergency cases outside the hospital. It aim to deliver the healthcare system at a doorstep of helpless and ailing needy of the city. This also aim to augment the disaster management system of Calicut Metro, Malabar in Kerala, and finally, when it is focusing in entire India. What is the current position of ambulances in Calicut? This is the picture before starting the angels. There are more than 200 registered ambulances are available in Calicut district, and unfortunately, if you want to contact one ambulance, at least you have to keep a directory and you have to remember at least 600 access numbers. That means every ambulance have at least two mobile number and one landline number. And another unfortunate scene is that 90% of these ambulances are waiting in and around the hospitals and medical colleges to receive the call from the hospital, and they merely 90% of these ambulances are merely act as dead body carriers. And yes, more than 50 ambulances are there among the two. After the 200, more than 50 ambulances are exactly situated in front of Calicut. So in the current scenario where the ambulances are working, they are working in the post hospital care limb. They are mainly involved in to take the discharged patient from the hospital, to carry dead bodies from the hospital, and also involving in the intra-hospital transfer of the patient. At the same time, the sick patients are coming to the hospital by using the vehicles like auto rickshaw and other vehicles. So the angels is aiming to transfer the position of ambulances from the pre-hospital care limb to the pre-hospital care limb of emergency medical care. So the Anchil's operation started in Calicut under the auspicious guidance of district administration, which include the other people also, like policemen, police force, social organization, media, fire force, ambulance operators, hospitals, general public, students, etc. Actually, in Calicut, Angel started from minus. It was nothing there in Calicut. So we had the structured body, registered body to run the show of ambulance network in Calicut. Here is we have a core committee, we have administrative body, we have the rules and regulation, we mobilize fund, and then we move to the concept implementation, and along with that we network the ambulances in the Calicut district. So it was not a jump from one point to another. It is like a phases, phased step manner development, starting from big small beginning, and now it is reached to another level. We did the mapping of the Calicut district. We mapped the routes and highways, railway station, hospital, bus and railway station, fire force, old age home, accident prone areas. All this incorporated into our district map. Ambulances also graded and classified into two. There is a basic life support and advanced life support ambulances. The basic life support ambulances is aimed to provide the basic care like oxygen suction and to save the basic resuscitation facilities, which will be manned by a driver and one ambulance assistant. And advanced care ambulances are fully equipped at a mobile ICU level, which include the all facilities to resuscitate the patient, facility to intubate, facility to drug administration, cardioversion, defibrillation, trauma management, all these included in the advanced level ambulance. Hospitals also divided into A, B, C. Like the A is a level 1 hospital with all facility. B is a hospital with around 100 bed with operation theaters, and C hospital is a small hospital with less than 20 beds. We launched a three-tier awareness program, which include the awareness program for the general public, awareness program for the ambulance operators, and the third level awareness program for healthcare providers like doctors and nurses. The concept of angels and the concept of networking ambulance, we simply use the information technology and how to save this how to utilize this technology to save life. Out of that, this is something like all the ambulances involving the network should be networked through the internet, GPS, with the help of GPS and GPRS. These ambulances are tracked. Somebody's met an accident from one point, they can call to the call center. The call center is working for 24 hours, manned with trained people. Once they receive the call, they can identify on the computer from where this call came, and then can also know that which is the nearest free ambulances available to the accident or the call site. Then what they will do, like they will redirect the call or forward the call to that particular ambulance, so the ambulance person and the person who called, they can interact, and the ambulance will reach to the scene in a shortest possible time. So this question is like, which should be the, I told you like in the beginning, there are 200 ambulances in Calicut. They have got 600 access number. In an emergency, there is no way to access the 10-digit mobile number. So what we try to do, like we bring into a three-digit number system for the emergency response. In India, we know that even before, even before our independence, we taught the people like to get the police, we should call 100, to get a fire force to call 101, and to get an ambulance call 102. But till this time, it has not happened in India. You can call 100, police might come. If you call 101, fire force will come. But if you call 102, never an ambulance will reach you. Now that we make a reality, like in Calicut, through these angels. Now you call 102, the ambulance will reach you at within less than 10 minutes or even before. So we implemented the three-digit single response number 102 for emergency access. The concept of angels was launched by our Vice Chancellor, Medical University Vice Chancellor, Professor K. Mohandas in November 2010. And we launched a website, exclusive website for angels, that is www.angelsindia.org, which was launched by our Industrial Minister, Shri Elamaram Karim. And then the dream became a reality. The phase 1 of Angels activity was inaugurated on 2011 February 18th by our beloved former President of India, Dr. APJ Abdul Kalam at Calicut. And the program, the Angel system, was active in Calicut, and the people could access the system or getting the ambulance through 102 on 9th March 2011.
സമയപരിധിയില്ലാത്ത സേവനത്തിനായി ഏഞ്ചൽസ് 102 വിളിക്കൂ. തക്ക സമയത്തെ പ്രവർത്തനം, ജീവസുരക്ഷയ്ക്കായി ഏഞ്ചൽസ് നിങ്ങളെ സഹായിക്കുന്നു. ഏഞ്ചൽസ് എപ്പോഴും നിങ്ങളോടൊപ്പം.
So we started functioning of the first phase of angels by networking through 20 ambulances. The console, Angels Consoles was started at Institute of Palliative Medicine in Calicut. We received a ambulance as a donation from Thai group. The footprint. This is a association of under palliative care for the spinally injured patient following trauma. They come forward to assist the operation. This is one area I want to emphasize here. This point, our angels office, the call receivers. I mean, the console operators are not like an ordinary persons like you and me. This is the first experiment even in the world. The angel's office is manned by the people who are already having the paraplegia following an accident. So this is actually we place is a part of the rehabilitation program, and the people who receive the call on the console, they know that the importance of the time, and if they delayed, they know that you also becomes like this. The program was started to work in a self-financing mode. Actually, the NRHM, this is the government agencies, allotted 20 lakh rupees for the functioning, but we are not utilized this amount. This is, you see that this is a picture of our console. The people are manning. The person who's sitting on the wheelchair, he's basically is a paraplegic person, and he is actually persons like him and other people are actually manning the console room, the control room, and they will actually redirect the calls in the event of medical emergency. This is the write-up given by the local media regarding the work of our console. The program was started with the first response provider course and hands-on training for the ambulance. All the angels drivers were received the first response provider course and the concept of trauma transport, basic life support, and disaster management before they are entering into the angel system. And we also gave the certificates, and we also gave them special uniform. This is again the few pictures from the biggest university of USA, or the Washington University. There is a George Washington University. They they offered the help, and they agreed to become a partner of the program Angels in Calicut. So, what are the transport conditions for the patient? The transport guideline for a patient: if the patient is conscious, he should be transported by his own choice. Driver or nobody else have any rule. The patient say, if I want to go to this hospital, the Angels ambulance should transport them to that particular hospital. If the patient is unconscious, this driver should follow the request of a sensible bystander. If the patient is unconscious, patient having doesn't have any bystander, then we transport this patient to the nearest healthcare facility. And as the patient is unconscious, from that facility, the driver should make sure that this patient, his life is stable, and the rest of the treatment can be decided by the doctor who are on duty of that particular healthcare facility. And all the destitute transport, underprivileged transport, and trauma transport are being done in free of cost. And if the driver and the ambulance people have some confusion, there will be an exclusive number 9747102102, and a doctor will be available for 24-hour on call. The services to the public is not fully free. It should be given in a subsidized rate. But definitely, those patients involving in road traffic accident, those patients like destitutes, underprivileged, all these transport angels will do the in without any cost. So the quality parameters are monitored by customer care cell, doctors panel, ethics committee, core committee, and academics. And we also have the more committees to manage this, like the show. For we have the HR committee, we have media spokesman, we have purchase committee, we have a finance auditor, we have a quality assurance body. The concept was accepted and it was a big success in Calicut. Many people like Act for India, Malabar Gold, Spasham, Thai Group, Kerala Police, All India Radio, George Washington University, MEMS, IPACE, Institute of Palliative Medicine, United India Insurance, IIMS, Calicut Press Club, all the many other people are joined with us to bring up this noble venture. We got extensive media support, left and right media support. The initial Angels crews include Dr. P.P. Salim IAS, Dr. Venugopal.P.P, Dr. Maruf Raj, Mr. P.M. Janardhan, Dr. V.P. Balakrishnan, Dr. Suresh Kumar, Dr. Abdullah, Dr. Ajit, Dr. Anup John IPS, Mr. T. A. Razak, and many other people subsequently joined in the program. All the success story was started with a group. This is a very trained, committed angels, drivers. They actually brought the concept to the public. And one word I want to tell, like, it is not merely an ambulance network, but something special about Angels Network. It is first time in India this kind of public-private participation has happened. It is the best community-based emergency medical care system and is a best model for entire India. It is not only for entire India, it is a model for the low economic resources countries like Pakistan, Bangladesh, South Africa, Sri Lanka, etc. This program is not taxing the government. It is not taxing the public or hospital. But what we are doing, like we are utilizing the existing system with facility, existing system with the facility upgradations. And actually what we are doing, we upgraded the ambulances operators to the core healthcare provider system. They thought that initially they are merely a dead body carriers. And after Angels, they realized that they have the role in the healthcare provider system. They, this is actually a landmarking of the pre-hospital care system with the most economical way. It has redefined the ambulances to a noble angel's role through a single life-saving access number 102. It offers most affordable insurance plan for emergency care. It also offers a lot of job opportunities. We started our work with the motto like emergency care should be the right of every citizen. So our motto is again saving life. It also ensuring the quality standards. We heard the support from international national agencies and the society was registered under non-profitable community-based charitable society act, and there is a charitable trust also to supporting the society. So again, this is to the emphasis the emergency medical care is the right of the citizen. This is especially important in the event of disaster. The disaster may be in a community level or an individual level. We should able to provide appropriate care to the society. In the 4th June 2011, Angels moved to a phase 2. In the phase 2, what we did, like we spread our wings to the neighboring district, Wayanad and Malappuram. The Calicut ambulance strength increased from 20 to the 50, and this is we also spread our wing to the outreach areas of the Calicut and the villages of the Calicut district. We ensured the quality upgradation of the ambulances. We ensured the facility upgradation of the ambulances. We started the EMCT, that is emergency medical care technician calls for the ambulance people, and we initiate to launch an insurance project in the emergency medical system. So this is the picture, some live moment, the launching of 102 rally at Cali, and this is the rally again. Few pictures from the face. The Honorable Minister of Social Welfare, Dr. M.K. Munir, launched the Phase 2 program at Cali Town Hall. We also enrolled the Malappuram and Wayanad district, and they also started to work in the Angels. We received the financial support from Malabar Gold. We also received 2 ambulances, one from uh, Midi Help Foundation India and another from Thai Group. The Anup John Kurivilla IPS is the City Police Commissioner who declared the trauma victim transport free in the phase. Here the 2 maps, Malappuram and Wayanad, as added to the Angels. Our workers are so committed. They are started to save life from time to time, from day to day. So we also thought about the insurance plan, that is Emerald. The Angel storyboard in short. This is the phase. This again the ambulance rally we conducted at the time of phase 2 launching on the 4th. Here this is the phase 1, phase 2 launch. Again few more pictures from phase. We also try to recognize the committed drivers from that district. Whoever is the drivers, ambulance driver who do a commendable job, we give the appreciation. Here is the film director V.M. Vinu appreciating a best driver, Mr. Ham. The EMCT first batch, when they come out, they did a Guru Vandanam program, and all the teachers and the students together participated in the program. We not only involved in the trauma and other, we actually received and carried the Jawan's body from Calicut airport. The Malappuram meeting, the people are again started, and they start mobilizing the funds, and they started working. This is the formation meeting at Wayanad. We did the health checkup program for the drivers. We also identified the health problem of the ambulance drivers, and we gave the corrective measures for these issues. Here it is the Honorable Minister Anil Kumar launching the Malappuram project by calling to one. Here this is the console. We were visited by Honorable Health Minister of Kerala, Shri Adur Prakash. This is the launching of Wayanad project by Honorable Minister Jayalashmi at Calcutta. Here, this is the training program is going on at Wayanad. This is again the ambulance rally done at Wayanad meeting. We conducted a big mock drill at Calicut airport. It was the biggest history of international airports. Here, more than 500 people participated in this mock drill. This was the most scientifically conducted at one. And the people, in the mock drill, the victims were properly triaged and transported into Calicut hospitals and Malabar hospitals. And following the mock drill, we analyzed the result and submit the report to the concerned authority. This is the closing meeting done under chairmanship of District Collector Dr.P.P. Salim at Calicut Airport. And without any delay, in the January 2012, Angels started at Kannur also. Honorable Chief Minister of Kerala, Shri Umman Chandy, launched the Kannur project. So, in conclusion, the Angels was a humble beginning. I know that it's yet to travel a lot. The destination is not very near, but not very far as well. It is a continuum process. We are facing problem every day, but our final mission is to save life. It is a people's project. They are supporting it, and we are just facilitating it. So this is to save life, and again emphasis, call 102 whenever you have a medical emergency. Thank you for all support, and thank you.